I'm Dr. Surabhavati. I'm a family physician who also takes care of the home care services at SMF. So you all want to know what is home care. Home care is a service which allows people to get medical treatment at their own comfortable environment, that is their home. And so who can avail this home care? Home care can be availed by mainly for the senior citizens who are bedridden and those who don't have anybody to bring them to the hospitals, and also from people who are recovering from surgeries, who need dressings on a regular basis, who need injections on a regular basis. This can be availed through our home care. And also for patients who are unable to come because of their disabilities, they are not unable to come to the hospital, can avail these home care services. So now we have seen who can avail the home care services. Now what are the services that we provide through this home care services? We have a doctor, we have nursing staff, and we also have physiotherapists who can provide the treatment you need at your home. So how can you reach the SMF home care services? It is reached through a specialized number that is provided in our website, as well as all the pamphlets that can avail at the hospital, and it can also be contacted through our appointments, where they will put through to the home care PR services. So once you book your appointment, at that time our PR people are trained to ask the history from the patients as to why they want a home care services, just to prioritize the patient. That if a patient has a high grade fever or is having giddiness, and there is a patient who just needs a review for a diabetic and hypertension, these patients are prioritized. First, patients who are having giddiness will be given a priority, or if a patient who is having a high grade fever, who has been having a poor oral intake, are given priority, and the doctor and the nurse goes to see the patient first, and then they go to see the patient who needs just a review for a diabetic and hypertension. PR staff gets the history, and then they contact the doctor, talk to them about the patient, and then they again call back to the patient's attenders and let them know at what time we will be available to come and see them at home. So once we prioritize the patients, we start seeing the patients, and the nurse and the doctor comes home. They check your vitals, and they check if you have any labs done or anything. We'll check, and clinically the patient is examined, and then from there we take a plan for the patient as to whether the patient needs admission or can be treated at their home itself. If it is at home, we give them a plan as to what all they need to do, and whether we need to come there and see them in a weekly basis or a monthly basis. How it's according to each individual patient's diseases. And if suppose if it is a fever patient, if the patient needs labs, immediately there itself the blood is drawn by our nurse who comes along with the doctor, and then we follow up the blood reports also and inform the patient. So that is how the home care services goes. Hope you all enroll in our home care services and have a happy service from us and a satisfied service from us. Thank you.